So, today we'll be talking about the benign disorders of the uterus. So, the benign disorders of the uterus can be divided into those which have to do with the endometrium, which is the internal lining of the uterus, and those which have to do with the myometrium, which is the muscle layer. ठीक है? Starting with the endometrium, one of the important benign disorders is an infection or an inflammation of the endometrium, which we term endometriitis. ठीक है? And endometriitis can be both acute and it can be chronic. ठीक है? And there are many important causes of acute and chronic endometriitis. Acute endometriitis commonly follows delivery or abortion, whereas chronic endometriitis can be because of PID, can be because of infection by an STD like chlamydia, and can be because of tuberculosis. In the case of tuberculosis, endometriitis is classically associated with endometrial atrophy. So this is the first benign disorder of the endometrium. Similarly, we have another one which is polyp, endometrial polyp, which is basically simply an outgrowth of the endometrium. And polyps are oftentimes associated with HMB, but more classically associated with intermenstrual bleeding or postcoital bleeding. So there is a classic association with postcoital bleeding, which is bleeding on trauma because of intercourse. So these are some of the initial conditions that we need to be aware of. Now, the benign conditions which have to do with the myometrium are significantly more important. So we will be concentrating on two conditions, fibroids and adenomyosis. ठीक है? So these are two conditions and they have many DDs. And the reason for the fact that they have so many DDs is because both of them present per-abdominally as a mass. ठीक है? जब भी आप किसी भी गायनी के केस को आप अप्रोच करते हैं, you start with history, then you progress towards examination and then investigations. Examination में you have the GPE, then you have the per-abdominal examination, then you have the per-vaginal, and then you have the per-speculum. And normally at the undergraduate level, we are limited to GPE and per-abdominal examination. And both of them present, not always, but quite often, per-abdominally, and so they have many DDs. ठीक है? So start करते हैं fibroids के साथ. इसके बाद we might talk about the endometrial conditions in a bit more detail, but they are fairly simple because we've done them in reproductive pathology too. Fibroids. Fibroids are also known as leiomyomas, and they're basically benign tumors of the myometrium, and they're stated to be the most common benign tumor in the female, ठीक है, of the reproductive tract. So the first thing you need to understand, primarily for the purpose of understanding, is the fact that fibroids are estrogen dependent, and this estrogen dependency has many implications. ठीक है? It is an estrogen dependent tumor. ठीक है? Alright, and it is likely to present during the childbearing age, during the reproductive age, in between 30 and 45 years of age. ठीक है? So 30 to 45 year, that is the reproductive age or the childbearing age. ठीक है? It is very unlikely for a fibroid to present before menarche or to continue presenting after menopause. Menopause के बाद, even if there is a fibroid, first of all उसकी growth cease कर जाती है. Secondarily, it tends to atrophy. So that again is very important. And these are important concepts even as far as management is concerned. Because if a female has fibroids and you're basically considering taking care of them and you don't necessarily need to preserve the fertility, so you might be thinking about hysterectomy. But if that particular female happens to be near her menopause, you might postpone the surgery in hopes that the fibroid will atrophy. Because hysterectomy is a major gynecological procedure and it is done at a GA, and it basically requires, it has basically a lot of complications. So you try to avoid it if you can. So it is a tumor of the childbearing age. It is very common. ठीक है? It is said that 20% of females who are around about 30 do have at least one fibroid. and fibroids are not necessarily symptomatic. Almost 50% cases are said to be asymptomatic, and they can be termed as incidental findings on ultrasonography for some other reason. ठीक है? So it is the most common benign tumor of the reproductive tract of the female. It is primarily considered to be an estrogen dependent tumor, and it is basically common during the childbearing age, during the reproductive age. So it is a common and a very important cause of HMB, yani heavy menstrual bleeding during the reproductive age. ठीक है? There are many causes of HMB, and you have to remember the time in female's life in which each of these is likely to develop. ठीक है ना? Childbearing age. Alright, so there are certain demographic details which must be kept in mind. First of all, fibroids are common in the nulliparous female, ठीक है? Because nulliparity means that there is greater estrogen exposure, ठीक है? And that basically predisposes towards fibroids, which are termed as being estrogen dependent, ठीक है? So this is important. We have to remember कि demographics में nulliparity का क्या मतलब है? No parity. So whenever you're taking a gynecological history, you start with the demographics, the name, the age, the sex, and the address of both the female and the male partner, as well as the residence. Then you basically inquire as to how long they've been married. ठीक है? Then you talk about the fact, particularly in the context of Pakistan, you talk about the fact whether or not the marriage was consanguineous or non-consanguineous. ठीक है? And then you ask the parity. If this was obstetric history taking, you would also obviously include gravida, because the female is pregnant at the time of presentation. But in a gynecological history taking, you mention parity. ठीक है? So demographics में the female is likely to be nulliparous. ठीक है? This is very important. Furthermore, there are certain features which are considered to be risk factors, and you can include these at the start of your history. ठीक है? जब भी आप GP करते हैं ना, ठीक है, in a female who is presenting in the gynae ops, OPD या ER, तो आपने BMI भी लेना होता है. You have to mention at the end of the exam, even if you don't have the time, that I would like to record the height and the weight of the patient in order to calculate the BMI. This is not something you ought to be missing. ठीक है? So BMI is important. So obesity is a very important risk factor for fibroids. ठीक है? BMI normal कितना होता है? 24.9 की रेंज तक, यानी 25 तक it is in the normal range. इससे अगर ज़्यादा BMI आ रहा है ना, तो उसको हम प्री ओबीस कंसिडर करते हैं, एंड उसके बाद बाकी क्लासिफिकेशन आती है. सो नल्लिपैरिटी इज़ इम्पॉर्टेंट, ओबेसिटी इज़ एन इम्पॉर्टेंट रिस्क फैक्टर. कुछ ऐसी चीज़ें होती हैं जो कि एक्चुअली रिस्क को कम करती हैं, विच इज़ वेरी इंटरेस्टिंग. ग्रैंड मल्टीपैरिटी हैज़ अ प्रोटेक्टिव इफेक्ट. A female who is, for example, para 6 is unlikely to have fibroids or is unlikely to present with fibroids. ठीक है? Similarly, smoking is said to have a protective effect. Again, because smoking is considered to be a hypoestrogenic state. ठीक है? Because smoking reduces the amount of estrogen in the body, and therefore fibroids के लिए भी वो protective है. So we've talked about the demographics. ठीक है? Fibroids एक benign tumor है, myometrium of the uterus का. ठीक है? We've talked about the age group, we've talked about the pathophys, we've talked about the risk factors. अब वो present कैसे करता है? ठीक है? Most commonly it presents with heavy menstrual bleeding. ठीक है? It can also present with something like subfertility, ठीक है, or with recurrent miscarriages. It can present with mass effects, upper वाले भी and lower वाले भी. ठीक है? Very uncommonly it is associated with pain. ठीक है? अच्छा, अब जो लोकेशन होती है ना, वो डिफ़र करती है फाइब्रॉइड्स की, बिकॉज यूट्रस के भी पार्ट्स हैं. वी हैव द बॉडी ऑफ द यूट्रस, वी हैव द सर्विक्स. जो ओरिजिन है ना, वो मायोमीट्रियम है. सो इंट्राम्यूरल फाइब्रॉइड्स हम कहते हैं, प्रेजेंट इन द मायोमीट्रियम. इंट्राम्यूरल फाइब्रॉइड्स आर द मोस्ट कॉमन टाइप ऑफ फाइब्रॉइड्स जो कि प्रेजेंट करते हैं बॉडी ऑफ द यूट्रस में, 75% बेसिकली. बट दीज कैन ऑल्सो बेसिकली प्रोट्रूड आउटवर्ड्स एंड इनवर्ड्स. इनवर्ड्स जब वो प्रोट्रूड करते हैं इनटू द यूट्राइन कैविटी, तब हम उन्हें सबम्यूकोजल कहते हैं. जब वो बाहर की तरफ प्रोट्रूड करते हैं इनटू द सिरोजा, वी कॉल देम सबसिरोजल. ठीक है? Alright, so if it is a submucosal fibroid, it is likely to present with heavy menstrual bleeding. ठीक है? That is the most common presenting complaint of a submucosal fibroid. 15% जो fibroids हैं वो submucosal ही होते हैं. उसकी वजह क्या है कि जब वो प्रोट्रूड कर रहा होता है यूट्राइन कैविटी में तो ऑटोमेटिकली जो सर्फेस एरिया एंडोमेट्रियम का वो बढ़ जाता है, देयरफॉर हेवियर ब्लीडिंग होती है। सिमिलर इसको तो मेनोरेजिया कहते हैं ना। सिमिलरली सब म्यूकोजल फाइब्रॉइड्स प्रेजेंट कर सकते हैं मीटोरेजिया के साथ, विच इज़ ब्लीडिंग other than the normal menstruation. क्यों? Because there is a protruding mass in the uterus which can get infected, for example during delivery या because of an abortion. तो जब वो infect होता है और ulcerate होता है तो it can bleed at times other than the normal menstruation. So अभी हम clinical features में we've talked about heavy menstrual bleeding, जिसको हमने divide किया menorrhagia में और metorrhagia में, which is very important. ठीक है, so we've stated कि some mucosal is more likely to present with HMB for the reasons so stated. Secondarily, oftentimes the presentation is that of an abdominal swelling, यानी पर abdominally आपको एक mass palpate होता है with certain features which generally differentiated from, for example an adnexal mass. ठीक है, अच्छा इसके अलावा it often presents with सबफर्टिलिटी वाली प्रेजेंटेशन क्यों होती है? बिकॉज जो फाइब्रॉइड्स हैं दे टेंड टू डिस्टॉर्ट द यूट्राइन कैविटी, सो इम्प्लांटेशन को हिंडर करते हैं। ओकेजनली दे कैन ब्लॉक द ट्यूब्स बेसिकली, एंड रिकरेंट मिसकैरेजेस क्यों होती हैं? अगेन बिकॉज इम्प्लांटेशन नहीं हो रही होती, ये इम्प्लांटेशन हो जाती है लेकिन स्पेस कम होती है, सो द प्रेगनेंसी डज नॉट बेसिकली प्रोग्रेस. Pain is a very unlikely feature of fibroids, ठीक है, but it can present with pain for a couple of reasons. Oftentimes gynecological conditions individually present नहीं करती, which is why if you have a gynecological case, a long case in your prof, तो आप अपने आप को लिमिट ना करें. इस अंडर ग्रेजुएट लेवल पर अनलाइकली बट हो भी सकता है. अपने आप को लिमिट ना करें जस्ट बिकॉज यू फिगर्ड आउट कि ये फाइब्रॉइड है डजंट मीन कि आपने बाकी लोकलाइजिंग क्वेश्चंस नहीं पूछने. हो सकता है फाइब्रॉइड के साथ एंडोमेट्रियाइटिस भी हो सकता है साथ में पीआईडी भी हो. ठीक है, सो ऑफन टाइम्स क्योंकि फाइब्रॉइड्स को एग्जिस्ट करते हैं बाकी कंडीशंस के साथ, मच लाइक मेनी अदर गायनेकोलॉजिकल कंडीशंस, सो पेन हो सकता है. सिमिलरली कुछ कॉम्प्लिकेशंस होती हैं फाइब्रॉइड्स की विच कैन रिजल्ट विद द प्रेजेंटेशन ऑफ पेन. सो अगेन दैट इज़ वेरी इंपॉर्टेंट. फॉर एग्जाम्पल डी जनरेशन हो जाती है. डी जनरेशन कब होती है?